Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, offering you a shot of wellness. I'm Yasmin, and I'm the Member Engagement and Communications Manager at GIG Gulf Insurance. Ladies, our episode today is about menopause, but I encourage the men to keep listening as well so you understand what the women in your life are going through and how you can help. We know it's inevitable, but let's get to know everything we can about it so we can prepare. We are here today with Dr. Bushra Gul, an obstetrics and gynecology specialist from Saudi German Hospital with over 22 years of experience. Dr. Bushra focuses on patient education so they know how to better manage their conditions. Welcome to our podcast, Dr. Bushra.
Thank you for inviting me. And menopause is some topic really I want to talk about it. You know why? Because our community, it doesn't talk about menopause, their symptoms, and the transition. So I'm really happy to attend this podcast.
Yes, that's why we chose this topic, because there isn't enough information out there. Okay, so let's just give a brief overview or like an explanation of what menopause is.
Menopause, like women, throughout the reproductive years or non-reproductive years, she has transitions. I mean, first she's a girl, a small girl, then menarche comes, reproductive years start, and then there's a point when periods stop and she transition into the menopausal state. So menopause is also one of the stage. It's not, as some people consider, it's the end of it, because we know a lot of people living their best life even after menopause, since we have a greater life expectancy these years. So women is expected to live a lot of years in the menopausal stage. And this is the time when women has achieved some career peak, and they also are excelling in everything. Their opinion matters. So all the more reason we have to address menopause and educate women about how to navigate the changes.
So at what age does menopause usually occur?
Okay, there's a range of the age, that is 45 to 55. Women can have menopause anytime, but most common is the average 51 years of age. But some women, they start menopause much earlier, like less than 40 years of age. So then we call it premature menopause, and it is determined by their lifestyle, by their genetics, by their disease status. So some diseases like autoimmune disease, lupus, thyroid diseases, they put women at risk of having earlier menopause. If your mom has earlier menopause, also that put at the risk of earlier menopause. If people have bad lifestyle like alcohol and smoking, or weight gain, these also put at risk of earlier menopause.
So does menopause just happen suddenly, or is there like symptoms when it's oncoming or like starting to happen?
It doesn't happen suddenly, just like menarche happens suddenly. So menopause doesn't happen suddenly. There's a whole big phase which is called perimenopause. It may range from 4 to 10 years. And this is the time when hormones will be fluctuating, they will be going up and down. And like this is the time which can be managed also. Sometimes your hormonal profiles will be good, sometimes they will be up or down. Or this is the time when you may miss periods, you may have irregular periods, and this should also be managed, and this is the best time. Or before that, women should have education, and she should know how to navigate all those changes.
So what are the common symptoms of perimenopause and then menopause?
Okay, perimenopause is some stage which is 4 to 10 years, which can have symptoms, which cannot have symptoms. Some people, and it is scientifically proven that some women has less symptoms, like Japanese women has the least symptoms, probably because of their diet contains a lot of soy, and soy has phytoestrogens, and some women has a lot of symptoms, and it just is not the racial differences. It could be even the socioeconomic status, disease status, education status. So there is a lot of factors which influence that which women will be feeling how much symptoms, and it could be asymptomatic also. And menopause is the time when officially you do not have 12 months no cycles, then you get the official diagnosis of menopause. So it's just you can say a milestone or some phase when finally for 1 year your hormones were not good enough, and then you are called menopausal. But this is just all the continuity of the things. It's not doesn't happen suddenly.
You talked about some factors that can cause premature menopause. Can you tell us more about that? Like, what can women do to prevent early menopause?
First thing, the genetics, you can't do anything about that.
Unfortunately.
Like you're born with those gifts or
Gifts.
Oh, yeah, exactly. I had one patient, she was very funny. She said, my mother was supposed to give me Mercedes, she gave me diabetes. So we are born with all those gifts. So number two thing is the lifestyle. So I will tell you, when I turned 40, I made conscious decisions. And so I made conscious decisions on my diet. So diet is the most important thing. I mean, nowadays, diet is the most important thing in every disease management. So processed food is the worst thing. Unprocessed food is the best thing. So when I advise my patient, from the young age, because I'm seeing them from the pregnancy, and even the younger girls are coming, like the PCO, it's very common in the young age girls. So I tell them that your kitchens, knife, processor, stove, everything should work less. So my favorite diet is hurled barley. So my favorite grain is hurled barley. So I recommend that a lot. My patients knows about it. So hurled barley is totally unprocessed with the husk. It takes longer to process. So lesser the processed, better it is. So juices should be less because they contain high fructose. If you have to take the um, fruits themselves, rather than having the juices. Also, I will tell you one small example. Like, we think that celery stick is such a good food, but let me tell you one small thing. If you take celery stick just like that, you're munching it, it has 6 calories. And maybe those 6 calories will be consumed because your gut has to work to digest it. And when you boil it in a soup, it changes into 30 calories. So it's just a simple example of how our food is changing. Then activity. Activity is very important. We are very sedentary. Most of us do job sitting 9 to 5, then we reach home, we are tired, we want to take rest, we have rest, and we have to have the Netflix shows, and then we are, because we didn't get time whole day eating whatever we wanted to, we have food in front of us, Netflix in front of us, and we are just eating and sitting. You know, I read sometimes back that Italians are the slimmest nation in the world because they take night stroll, and night strolls are amazing. So a smartwatch is 8,000 steps. So these things are also, because the era we are living, we need motivation to walk, we need motivation. So even if you cannot hit the gym every day, at least you can go ahead with your 8,000 steps or 10,000 steps goals. So lifestyle, most important thing. If you're taking alcohol, limit the alcohol intake, and moderation is not the key when it comes to the alcohol. The problem with the alcohol is the data is very controversial. Some say that benefit is not there, some say there's no harm, but there is a harm. Smoking also has to be quitted. I mean, smoking has no yeses, no moderation. If somebody suffering from the chronic disorders, they have to manage those disorders proper way.
So what are some changes that women go through physically and emotionally when they start their menopause journey?
It's so different for everyone, and some may be suffering a lot, and some may not be suffering at all. And since we are living in an era where quality of life is very important, like if you're a boss and you are leading a meeting and then you break down to the hot flushes, it will be real big thing for you. Or even if you are an adult at home and you have a family, your daughter-in-laws coming and you have to show your best, and then you're breaking down into the hot flushes, and that hot flushes is accompanied by anxiety that you don't want to do that. You want to be your best self for such occasions. So, and if you're an alone person and not in very quality of life person, just sitting somewhere in isolation and breaking down into the hot flushes, you might not think that it's a real problem. Maybe you'll just wash your face and that's it. So one thing, the perception of the people could be different depending on what life they are passing. It could be hot flashes, night sweats. Hot flashes is like, it's an intense feeling of heat that is especially in the face, neck, and the chest. And this can be accompanied by chills, perspiration, anxiety, palpitation. And then there are mood disorders. You can be irritable, you may not be feeling good, and there could be some other real risk with the menopause, which is brittle bones. Your bones being at risk of being broken easily. And there's something real risk, which is cardiovascular risk. It can put you more at the risk of strokes. So these all things should be addressed and managed, and these all are preventable if somebody has education beforehand and they know how to navigate all those changes.
So how can we navigate those changes? Like if someone's
course.
hot flushes, night sweats.
Of course, yeah. So for the hot flushes, if the best therapy, of course, is the HRT. But I would want to tell something about the HRT. There was a time when I was doing residency, like in 2003 or somewhere. There was a study came, and WHI study, which made everybody scared of the HRT because they talked about that HRT causes cardiovascular risk, strokes, cancers, breast cancer. And that was a time suddenly we all stopped writing HRT. And then there came the time when people start going back. When the detailed analysis of that study came, it showed that those people had strokes who were above 60 or those who were more than 10 years from the menopause. So you are eligible for having HRT if you are within 10 years of the menopause and you are still less than 60 years. So for mood changes, for hot flushes, for the night sweats, for all those, the best or first line therapy is actually HRT. But if you're not eligible, then there are other medications also. Like, so somebody who has hot flushes in the daytime, best medication for them could be SSRI, like fluoxetine. So they can take fluoxetine, and they can take, or they can also benefit from cognitive behavioral therapy. Cognitive behavioral therapy doesn't decrease hot flushes. It just make your perception different for the hot flushes. It's like you change the glasses to see certain thing. So you know hot flushes coming, and rather being anxious and angry or irritable on that, you know how to cope with that. Like you will dress in layers as I'm dressing right now. So if you're attending a meeting and you see that hot flush has come, you would rather remove your jacket and you will sit without jacket. And since it's many layers, you can be as comfortable as you want. And there are certain products also which can provide you coolness, like some cool sprays, so you can cope them in a nice way without other people realizing what's happening. For the night sweats, there are so many products. We are living in 2025, it just started. So there's so many products like If you go IKEA, you will find their duvets, their mattress toppers, which are like for the coldness also, like
Yeah.
their
Temperature or
exact
something.
temperature
Yeah.
manipulation you can do with them. And there are certain pillows which are called cold pillows. So I was so impressed by all those things that we are living in an era where we can modify a lot of things. So, and keep your temperature cold if you're sleeping. Also, there are other medication which can improve your sleeps, like gabapentin. So that is especially for the women who cannot take HRT, but she has sleep disorders in the night. She sleep disturbances due to menopause or the night sweats. So that is very effective, and they can benefit from that. You know, Oprah Winfrey, she had a weight gain because of menopause, and this was because she had sleep disturbances in the night. And when you didn't had sleep in the night, in the morning, you will have altered perception that what you need, is it the sleep or the food? So any person who has sleep disturbance in night, they can be at the risk of having more food because of the altered perception whether they need sleep or they need the food. So now she has controlled her weight, and she openly talks about this, that how menopause can alter your perception and how it can put you at risk of weight gain just because of a simple thing, that sleep disturbance, but you didn't know why it happened and what could be the best management for that.
So we've talked about hot flushes, we've talked about night sweats and weight gain. What are some of the
I
other?
want to add some more thing
Sure.
with the weight gain.
Yeah.
There's a special kind of weight gain which we all hate, menopause. So your whole body can be slimmer, but you will have more weight in the belly, which is called menopause. So, you know, and that could be really frustrating for some women. I have one teacher came and she said, I think I am menopausal because the distribution of the fat in my body is totally altered. I did all the hormones and everything, and it came all normal. And then I just tried to remind her, look at the distribution. You have something in the back of neck also. You have something in arms also. So a lot of people know that when they are gaining weight, something is with their hormones. So if you see that thing, menopause, like the spatial distribution of the fat in the body also, that could be especially due to menopause also.
Okay, interesting. What are other health risks that are associated with menopause?
These are the risks which could vary, the mood disturbances, night sweats, hot flushes. I want to talk about one more thing, the skin changes. You know, Noemi Watts, I'm referring all these, referencing the, I will say
Celebrity.
again, yeah. So I want to talk about skin changes as well. One of the celebrity, Noemi Watts, she talks about the skin changes with the menopause a lot. She started perimenopause at the age of 36, and she says just because there wasn't any community advice and there was little education how to navigate those changes, she suffered a lot and she didn't had idea what was happening. So after she overcome and she knew, she started her own skincare line, tailoring especially for the menopausal women. So there could be skin changes as well. I was reading a book, and in that book, the author talks about her grandmother's picture, which used to be a different Greek nose when she was young, and once she was menopausal, it became hawk nose. So she wanted to tell how her bone mass dropped down and it made the changes in her bone.
I didn't know that could happen.
Yeah, exactly.
Okay. I think also osteoporosis is one of
Exactly.
the,
That is one of the risks, which is a real risk. So if we keep the skin changes separate, if we keep, there's something called silent osteoporosis. So when people do not have symptoms, and even people who have symptoms, all of them can have the real risk of brittle bones or the osteoporosis and the cardiovascular risk. These two are very important. So even if you don't believe in the quality of life, you must go to the doctor, and you should talk about these two risks. So what women has to do once they're menopausal, or before that better, because they can regain their bone mass before menopause better way. So what they have to do, they have to go to the doctor and ask them to have evaluation for the bone health. So how it is done? It is done by DEXA scan. So in DEXA scan, they can actually give you a score which will tell you whether you are osteoporosis or osteopenia or brittle bones, what degree, and they will also tell you how much is the 10 years risk of having the bone fracture. So depending on that risk, they will give you treatment. This is the place where HRT is not the first line medication. Here you have to take medication which is especially designed for osteoporosis, like bisphosphonates. And even if your bone health comes normal, still you need calcium every day, which should be around 1200 milligram, and vitamin D, which should be 800 to 1000 international unit every day. Especially the women who is above 40, they should start these medication, so they should not be at increased risk of brittle bones. Beside that, what lifestyle modification we can do? We need to have the walk, we need to have resistance training, like holding something, taking up and down or against the wall or something. That should be resistance training. And they have to do the other exercises also. Beside that, they have to limit alcohol, they have to quit smoking, and they need to have the regular checkup of the bone health as well.
Okay. What about cancer? Like, does menopause affect a woman's risk of developing breast cancer or ovarian cancer?
Okay. Endometrial cancer, of course, decreases. But this is the age, if you get menopausal bleeding, postmenopausal bleeding, you must rush to the hospital, because this could really be signaling cancer. Ovarian cancer, same age, is at risk, but ovarian cancer screening is not available. But still, I will advise that yearly doing the pelvic scan or transvaginal scan will be good. It's not that menopause put them at risk of having the ovarian cancer. It might decrease actually, but this is the age when people are at risk of having ovarian cancer. So it's not menopause, it's their age. So after menopause, if any suspicious cyst or anything, this should be addressed seriously, not because that their menopause is putting them at risk of ovarian cancer, because their age is putting them at risk of ovarian cancer. Breast cancer, menopause per se doesn't increases the risk of breast cancer, but breast cancer can be increased risk, but breast cancer risk can be increased due to HRT. So when we give HRT, we also tell women that you need to have a regular screening of the breast. But even after 40, without HRT, everybody has to do the breast cancer screening. So, and one point I want to tell about the breast cancer screening, it doesn't decrease the risk of having breast cancer. It increases the detection of early stage cancer, which translates into increased survival in the breast cancer patients. So having a screening doesn't decrease the risk of having breast cancer, it increases the chances of early detection and better survival. While in cervical cancer, actually cervical cancer at the 65 years of age, you stop screening. That is the cancer where you increase the detection, detection before the cancer happens. So you have a longer time frame where you detect the changes which are actually pre-cancer, and then you can treat them, and women will never have the cervical cancer.
You mentioned that there's silent menopause, and there are two major health risks that go with it. One is osteoporosis. What's the other one?
Cardiovascular risk. So it's a paradox here. So if you got menopause within the 10 years and less than 60 years of age, If you took HRT, your HRT will help your cardiovascular risk get better. But if you're above 60 or you're not within the 10 years of menopause, HRT will increase the risk of cardiovascular disease like stroke, having clot formation. And if somebody who already have the disease like diabetes, hypertension, and they were suffering from polycystic ovarian disease, they are at an increased risk of these diseases. So for that, women should actually do the lifestyle modification. Again, the exercise, the endurance exercises, low trans fats and low salt, low sugars, and they need to go to the doctor to check their blood pressure, to check their sugars, to check their lipid profiles, and even if they want to decide to take HRT, this will be important factors whether they are eligible to take the HRT or not.
Okay. Yeah, that's important. Thank you for highlighting that. So how do women's lives basically change after they go through menopause or while they're going through menopause?
I want to give reference of Michelle Obama. When she was in White House, she was having the hot flushes. And still, she gave us the quality First Lady. So it's not the end of everything. Some people think that menopause is done. Now women living their good years in menopause, and I would want to again give reference of Salma Hayek. I think nobody's as vital as her.
No,
And she talks about menopause and she says that you're not done here. You still have a life. And she's really, I love her energy. And then we see Drew Barrymore. She has a talk show of her own, and she talks about menopause frequently because she wants to destigmatize the menopause talks. We have Oprah Winfrey with full of her energy, and she controlled her weight gain, which she had because of menopause, which caused her night sweats. And we have Angelina Jolie, who had surgical menopause because of her BRCA1 gene, which put her at increased risk of ovarian cancer and the breast cancer. So, and she's in the good energy. So I want to tell you that it's the education. We must believe in self-educating for what's coming. So we all can cope it better and we can deal with it in a good way rather not talking about and being silent. I was talking to one person, he's a boy, and we were talking about some medical talks, and this boy, he said that I asked my mother about the menopause and I asked her what you were like. She said even her own husband knew it after 2 years later when she already had menopause, because she didn't talk about menopause even in the family. So I think this is the time we should destigmatize these talks. We should talk more about this, and we should, and even seeking help, because there are a lot of options and they are customized according to the needs, and everybody is a different person. And I want to talk about one more thing, the bioidentical hormones. These are tailor-made for the perimenopause. So if somebody is having the changes, not yet the menopause, they check the blood, they check the saliva, urine, and they monitor that which hormone is especially deficient in some person. So they make the customized preps which can be given, and these customized meds are called bioidentical hormone. And beside that, there are other things also like black cohosh, and there's isoflavones, the phytoestrogen. I talked about soya. So there's so much help, but important is these should be talked about. These information should reach to the women in the timely manner so they can utilize all those information rather after menopause, like Noemi Watts, and she get to know what help was there already.
Yeah, that's why we're here. So
Exactly.
to do our part. Okay, you mentioned calcium and vitamin D as essential supplements for after menopause. Any other vitamins or supplements you advise women to take?
Actually, nowadays we are in Dubai also, and there are a lot of people who are actually doing the tailor-made supplementation. They take your blood levels and they can give you those meds according to you. Also, magnesium has been said to, like beside our main medication, if somebody has diabetes, hypertension, thyroid, any problems, there's no question not to take those medication. People think that once they started, it's a no way back. I will tell you, for the diabetes, glucophage, like I'm talking about 20 years back, we used to take just for the weight loss. And then later it was proven that glucophage is not for the weight loss for everybody, it is only for the polycystic ovarian disease. And then recently I was just seeing somewhere that glucophage may be an anti-aging medication also. It's just not big research. But I was just thinking, people think that glucophage, once they started, they cannot. And we took it and just for the weight loss in our young age, and it didn't harm us. So there's no question that we should not take those medication. Beside that, yes, we should take magnesium, we should take calcium, we should take vitamin D, and we can see our specific needs. Maybe our heavy intake of coffee and tea might be putting at risk of certain supplements, but mostly we have to be on the supplements, but that should be customized to each individual.
Okay, great. What is your advice to all the women listening to us today?
Educate yourself. You're in Dubai, or even if you're not in Dubai, there's so many communities now working. Like I participate in Mamahood. They were deciding to make some community talks for menopause. I work in Saudi German hospital. Saudi German hospital is also deciding to have community talks for the menopausal women. So I think time is changing. There are a lot of women, and those women really need help, and people are realizing. So educate yourself first thing, and just having education is not enough. You should have dedicated consult for the menopause or for perimenopause, and you need to have a dedicated discussion with your gyno about the menopause, and you need to have advice, and you have to follow the advice also.
My last question for today. What are some myths that you would like to debunk about menopause, like about HRT, or just the conception or like the perception that your life is over?
Yeah, I was just listening to some other doctor's podcast, and she said that she's from Pakistan, and she lives and practice in US, and she came in Pakistan and she started talking about HRT, and she was in shock that doctors are speaking against HRT. So, that WHI study, probably people should go back and start reading. Things have changed. And HRT is not universally dangerous, but again, it is customized. Like people need evaluation, they need to see whether if they're at risk of breast cancer, of course they cannot take HRT. If they're at risk of stroke, of course they cannot, but it's not universally dangerous. Like after your evaluation by the doctor, and one should not start HRT themselves. They need to have evaluation by the doctor, and after evaluating their risk, they can decide that whether they are okay with HRT or not.
Okay, so there is HRT, there is the that menopause doesn't mean like your life is over.
Oh, no way. I told you all those celebrities. Salma Hayek, Michelle Obama, Oprah Winfrey, Angelina Jolie, Drew Barrymore, Naomi Watts. I think we have a long list. And the good thing is, it's not a stigma anymore. If these celebrities are coming out and talking about their menopause, we should be open about it. And it's just a phase of life, and we should take it as a phase of life.
Yeah, you're absolutely right. Anything else you'd like to say?
One thing, like menopause doesn't happen suddenly. It precedes perimenopause, which could be 4 to 10 years. For some people, as the Noemi was said, that it started for her at the age of 36. So you should check yourself. The perimenopause can start much earlier, and there are treatments, and there are medication, there are lifestyle modification, and the most importantly, there is certain education which can help people to navigate all those changes. So it doesn't happen suddenly, it happens in phases, and it is progressive, and finally the day comes when you don't get periods, and once it is 12 months, people are called menopause. But it doesn't happen suddenly, it progresses.
Okay, great. Thank you so much, Dr. Bushra. This was very educational and
Pleasure.
Yeah, thank you for joining us and to creating awareness about this.
Thank you for inviting me.
Thank you. To all the ladies out there, hopefully we were able to benefit from our talk today and that you are now a little bit more prepared. As you probably know, we're available on YouTube, video and music, Spotify, Apple Podcast, Anghami, and Amazon Music. Stay well and keep thriving.